Hi, friends. This is Stephanie Patton, the prevention coordinator for the town of Stoughton. And here is the next segment in our 2026 data review series from the Youth Health Survey. Today, we're going to talk about mental health, a little bit of a complicated topic, super important, especially during that developmental period of middle school and high school. And so, here is a snapshot of some of what we've learned from our students this year on the surveys. So we do ask about self-harm. Self-harm means behaviors like cutting or other self-injurious behaviors that are not intended to be suicidal, but that certainly are a behavior that we want to be paying attention to. And so here you can see in that sort of teal bar what students are reporting in terms of self-harm over the past year. We also ask about depression and anxiety. The depression question is a question that comes from the YRBS national survey and is the metric for capturing a snapshot of depression. It's a lengthy question about whether students have felt so sad or hopeless over a 2 week period during the past year that they stopped doing their usual activities. And then we also ask a question about anxiety. That question is measured over the past month. So just to note that the anxiety question has a different time scale than the depression and the self-harm questions. That's over a smaller period of time. And certainly, that is a non-clinical question. So it's students really self-reporting, feeling anxious. This is a little bit of a deeper dive into depression and suicidal ideation here. And so that red bar at the top, you're going to see this sort of by grade, 6 through 12, are the percentages of students that reported depression in the 2026 survey. We did note there's kind of a significant increase with 12th graders. So sometimes surveys like this generate additional questions. And so that is certainly something that we want to be looking at and thinking about, paying attention to, and asking some more qualitative questions of our students, why that number seems to have spiked in 12th grade differently than in other years. The blue bar is students who have had thoughts about suicide. And, that is a little bit of a tricky question, especially in younger grades. Sometimes it's not uncommon for students to think about, well, what would it would be like if I wasn't here? Not exactly the intention of this question, but sometimes those kinds of numbers get picked up here. And so you can sort of see as we move down the graph, we start to become a little more or a lot more concerned about these behaviors. Students who actually report that they made a plan in terms of suicide so that they had actually thought that through enough to have thought about having a plan. The lines overlap here between 11th and 12th grade. That's why it appears that that purple bar disappeared. This is concerning. This is a place where we definitely want to be thinking about an intervention if one hasn't happened yet. This is part of the reason why we also train student peers in signs of suicide. It's really important for young people and for adults if you hear a person expressing suicidal thoughts to really be asking them if they are thinking about killing themselves, if they have made a plan, and then really staying with them and getting them connected to an adult who can help them. That's really important. And that's some of what we are teaching our kids and community members. And then the final bar, that green bar, is actually made an attempt. There's an additional question on the survey about an attempt that needed to be treated by a doctor or physician, which speaks a little bit to the severity. But regardless, that green bar is, of course, very, very concerning, and which is one of the reasons why we really want to take all of these behaviors seriously and make sure students are connected and know where they can get help and support. We did see in one of the earlier brief presentations about connection, most kids really do feel like they have an adult in the building that they can talk to. We want to really make sure that that is true for every student, and that kids know how to get that support. Sometimes these issues happen during adolescence, and kids are dealing with a lot of significant things. And so we want to make sure that they are well connected to resources that they need. So that is this segment. If this brought up feelings for you, this, of course, is probably one of the most sensitive pieces that we talk about. It's really important to know for students and for parents, you can reach out to the counseling center offices in the schools or an administrator if you have any concerns about this kind of behavior, your school adjustment counselors, the Stoughton Youth Commission, or use one of those hotlines, 988, and get connected to a helping resource if these kinds of things are feeling really relevant and concerning for you. I will see you in the next episode. Thank you for being here.